switch over and make it work to your workflow as easy as possible. So I wanted to discuss the first option with you, and that would be to switch your system or your account completely over to version ICD-10. And this is going to deactivate all of your ICD-9 codes for future encounters and switch over completely over to ICD-10. So as the practice administrator, whoever has that role within your practice, you're probably familiar with the administration section. Under the administration menu, the drop down at the top, you're going to select General. And within that General section, you will then select the practice settings, which is where a lot of your custom features are changed within the system. And then about 2/3 of the way down the page, you will find the option to select your ICD version. So again, we're discussing the option to completely switch your system over to ICD-10. And by doing that, you will just switch from ICD-9, which should be highlighted now, to ICD-10. As a result, you will only see the ICD-10 codes when you search for a diagnosis within your account. This applies to the history section, your problem lists, your favorite lists, and the assessments. The second option we have is to leave the version set to ICD-9 and enable the ICD-9 to ICD-10 converter. This will allow you to search just like you are now using your ICD-9 codes or the diagnoses in the search field under the assessment tab. And then we have a feature that says click here to suggest the ICD-10 code. So in order to enable the ICD-9 to ICD-10 converter, under the same section, the practice settings under your administration and then general, you will keep the ICD-9 version checked, and then I know my screen says 10, so that's wrong, but you'll check the box that says ICD-9 to ICD-10 converter. So again, you will leave the ICD-9 version selected and then check the box that says enable ICD-9 to ICD-10 converter. And as a result of this, you will type in either the ICD-9 code or the diagnosis, which will then generate your ICD-9 codes just like it does now. And then you can check the box that says suggest ICD-10 code. This is going to pull up a list of ICD-10 codes that match that ICD-9 code. And you can then select the code that you prefer by tapping on the plus sign, which will add it to your visit note. So those are your two options as you make the transition from ICD-9 to ICD-10. I did make a few bullet points here, things to keep in mind. The first thing is that switching your ICD version will not change any previous diagnoses from your past visits within your patient's history or your problem list or any section where there is a diagnosis code currently. Under your favorite lists and your patient's medical history and problem list, you will need to go back in and update those to reflect the new ICD-10 codes. And there is a note here that says that the converter is not accessible in these areas. The converter is only accessible in that assessment tab within the patient encounter. And then finally, we did receive a notification that in July, the Centers for Medicare and Medicaid, CMS, they agreed to a 1-year accommodation period after the ICD-10 compliance date in which claims incorrectly coded will be paid as long as they are coded in the appropriate family of codes. I believe that could possibly go to some of the private payers, but as of right now, that is in effect for Medicare and Medicaid.
Lindsay's doing a fantastic job. Basically, just to kind of alleviate a little anxiety if anyone's having any. And that is, you know, we created this tool here, which is actually approved by the AMA to help with conversions from ICD-9 to ICD-10. And currently, what you would do probably now in your practice is you would choose your ICD-9 code. You then can click here, and it will actually quickly give a quick conversion so that you can then click it and switch over, and now you have an ICD-10 code. When you're satisfied with that selection, you then click Add, and then it will be brought here down below for your assessment. Another important thing to keep in mind is that you don't have to choose a code. Some doctors may not feel comfortable or just don't want to down with this solution. And it's certainly possible to type in anything you want. So you could just type in cough and then add, okay? And the system will try to automatically match the code for you, but even if it didn't match a code, you can still move on and finish your plan and not worry about it. And then maybe your biller can come back later and adjust the codes for you. The only time where you have to actually choose a code, whether it be ICD-9 or ICD-10, is if you need to order an electronic lab and you want to be able to bill the third parties, such as the insurance companies and things like that. If you want to order an electronic lab and choose to bill yourself or your practice, you can choose bill client, and you can overcome that. You do not need to have a code for that. And if you want to bill the patient, I believe you also do not need to actually have a code for that either. So everything else on here does not necessarily need an actual billing code. And so that might be one way to help the providers continue to move forward until they feel more comfortable doing the coding themselves. And as she highlighted earlier, if your favorites list over here has already been created to match ICD-9, what you have to do at some point before the 1st of October is type those same things in here. So, for example, I see dermatitis fasciitis. So if I type in 698.4, I can go ahead and use this converter to give me an ICD-10 code, and then take that code and go into my favorites and update my table. So then I can just basically just take this code number like so. I can go into my favorites, which is under here, medical diagnosis. I can then find the one I want to update. See if I can find it real quick. There it is. And then just change the code to match ICD-10 instead. So that's something that will have to be done manually. If you also choose to have, sorry, Lindsay, go ahead.
Oh, while you're there, I wanted to point that there was another question that was if the converter was available in the History tab.
The actual converter itself is only available in the Assessment tab right now. We will be adding it to be in this area as well for you, but right now it's not available in the product, so you actually have to go back to an Assessment tab area and do the conversion manually. Or you can actually use online converters. There are many websites which actually can help you convert those codes as well. You may choose or may not choose to actually use the medical history area to be coded. A lot of times providers want these to be a code, but some you don't have to. These can actually be just free text. So usually for medical history, for example, if you have hypertension, you can just do that and click Save, and you're fine, because it's never used for any coding. Lastly, I'll mention that in the encounters area, you have the point of care items, and those are the procedures or injections or things like that that you're actually doing in your practice during your encounters. And these will also need to be updated, this entire area. So this is another area that you don't want to overlook. And right up here, you can predefine your code ahead of time, and that would be under the administration, point of care, and you would basically just grab any test. You could then put in your ICD-10 code right here, okay? And so let's say cough or whatever, and then you would just put in the ICD-10 equivalent here and save it ahead of time. And if you do that, then you don't have to worry at all during your actual encounters with your patients. It'll already be predefined. And so basically that's all. I just kind of wanted to highlight that in case anyone had any questions. There's a little bit of manual work involved basically, but using the converter and the assessment I think will greatly help speed the change for you. And of course our support department is also available. You can contact them if you have any questions. And that's all I wanted to add.
Thank you.
Okay, so I'll turn it back over to you guys.
Thank you, Dr. Abate. Lindsay, there was one more question. Once you select an ICD-10 code in the plan area, will it be added to the problem list? An example is HTN 401.9 in my problem list. If I choose an ICD-10, will both be listed in my medical history and problem list, or will one override the other?
So under the assessment tab, when you add your diagnoses, whether it be ICD-9 or ICD-10, there is a box at the bottom when you have a list of assessments that have been added to your visit encounter that says you can add to the patient's problem list. Okay, thank you. Can you see my screen?
Yes.
Okay. So let's say your example was, well, .9, and I add it to my encounter. I can add to the problem list. Now let's say this was the ICD-10 code, and there was already an ICD-9 code in the patient's problem list. It will add both of those, but you can remove just by simply clicking the red X next to the one you would like to get rid of. Did that answer the question? Hopefully.
All right. So, and they said yes. Okay, wonderful. So we're at about 11:57 a.m. Central Time. We don't want to take too much of everybody's time this morning.